Hello everybody, welcome back to DaVinci Academy's Chapter 7 unit of the head and neck. Here we're going to discuss the nose. So the nose is a very important defining feature of the person's face. It's a centrally located structure that helps with many different things like inspiration, olfaction, access to sinuses, helps with modification of the air, to help with humidifying or warming up the air, and also help with sound resonance and actually speech patterns. So in terms of the nose, and inspiration of the nose, there's actually 4 passageways for the airflow of the nose based on the different conchi turbinates that are located that we'll discuss in a little bit. It's also important for olfaction because it holds the olfactory cells superiorly as they project through the cribriform plate. It's again important for sinus entrance because it has numerous entrance ways to the associated sinus cavities that we discussed in the osteology chapter. And again, it's important for air modification because the turbinates and the mucosa that are present in the nasal cavity actually help with warming and humidifying that air to allow for proper phonation and treatment during expiration and inspiration. So we're going to talk about the structural components of the nose. So the nose is divided into pretty much 2 different areas, the external and internal portions. And the overall shape of the nose is best defined by the ethmoid bone and the nasal septum. So when people have larger noses or smaller noses, it's usually because that nasal septum, that bony portion on the top between their eyes, and that cartilaginous structure, that dorsum of their nose, helps define what their nose looks like. So the external nose, it provides that shape. It's composed of 2, cartilage, and composed of fibrous fatty structures. It's also composed of bone. So in terms of the different components of the nose, we're going to run through those. So your nasal bone is actually the superior portion of the nose and makes up the bridge of the nose, so right around here. You have your maxilla. This provides support for the base and lateral walls of the nose. You also have your septal cartilage, which is not visualized in this image, but it's the internal portion of the nose. It's the medial wall in both nasal cavities. Your lateral cartilage, this is a cartilaginous structure located in the middle 1/3 of the nose. It's your lateral cartilage. You also have your alar cartilage, which is, alar also means wing, so you have your greater alar right there, that's your alar wing, and you have a lesser alar as well. And this helps support the lower lateral portion of the nose. You get your soft triangles, which are not really visualized here, but that's where your soft triangles are, and that's just like a small cutaneous area that helps define a very important aspect of the nostrils. And then you also have fatty fibrous tissue that comprises a circumferential structure around the nostril, so right around here. It helps define that wing of the nose, to more or less. And then you also have a structure called the columella, and the columella is actually right around here. It's what connects kind of like the underneath of your nose to your upper lip, and it gets very susceptible because there's a little artery called the columellar artery that exists there, and it comes off of the superior labial artery. And it can actually get injured for whatever reason. Because of any injury to the columellar artery at the columella, you actually are at an increased risk of necrosis or edema or problems to the tip of the nose. And that's why the columella is so important. So in terms of the internal nose is mostly composed of the mucosal lining, the turbinates, as well as the nasal septum. So nasal septum and all these structures and the turbinates helps with just controlling the inspiratory function. So the internal nose also has this cartilaginous septum, as you just mentioned. The lateral cartilages that help make up the dorsum of the nose are not intimately connected, but they can be dissected away from that septum. So to kind of explain that in detail, if you were imagining you're looking on the head of the nose like this, and you were to break it down, you can get your septum like pretty much along the midline. And what happens is you have your cartilage structures that are on both sides, and you could actually, in surgical situations, actually dissect this cartilage away from this septum. So in terms of the nasal septum, the internal nose, the structures that are associated include the nasal bone, the superior and posterior portion, right here. You have your maxillary, which is the lateral and inferior portion. You also have your palatine bones, your ethmoid bone, which is this portion. You have your vomer, which is right there. You have your septal cartilage and your alar cartilage. So this is your cartilaginous septum, your ethmoid portion, your vomer portion as well, your palatine, and your maxilla. These are all the different components that make up that internal nose. And it's kind of very important to know the different bony structures and cartilaginous structures that make up the septum. So when we continue to talk about the internal nose, it's important to talk that the nose, structurally, it's highly complex. It has many different intertwined bones, many different cartilaginous structures, and it's not like an axial bone or an extremity bone. It's very unique in its fusion pattern. So the nasal root of the nose is the junction of the nasal bones and the frontal bones and provides the base of the nose. It's right about here. This is the base of the nose. So the nasal bones are also formed sutures with the maxilla and lacrimal bones on the medial aspect, inferior medial aspect as well. So when we talk about the internal nose, it's also important to talk about the cavities as well. And the nasopharyngeal roof communicates with the cribriform plate, and it's the access way for the central nervous one fibers into that nasal cavity. Other than that, the olfactory nerve does not actually enter into the cavity. In the posterior region of the nasal cavity, posterior superior region, has what is called the adenoids, which are lymphoid tissue that help with just fighting off localized infections. So other important structural nasal components is the incisive foramen, is another one that we mentioned before previously. It's that canal that's located in the greater palate. It communicates with the oral cavity and the nasal cavity. And again, it's that passageway between the sphenopalatine and the greater palatine vessels. So now we'll talk about the nasal cavity in a little more detail. So the nasal cavity contains a structure called a meatus. And the meatus provides a communication from the sinus into the nasal cavity. So each meatus is defined on their location by the adjacent proximity to the concha of the nose. So the concha, or what are also called the turbinates, these are laterally bony outgrowths that are actually covered by mucosa that again help with that protection, that influence phonation, that humidifying of the air, but they also will protect the meatus, the entranceway into these sinuses. Another important aspect of the nasal cavity are the nasal hairs. These nasal hairs also help with protection against foreign particles. Just like the cerumen helped protect the external auditory meatus, these nasal hairs also help protection of the nasal cavity. So these nasal cavity have these conchae, these terminates that are divided into the superior, middle, and inferior conchae. As you can see over here to the right, here's your superior, here's your middle, and here's your inferior. So the three conchae actually allow for 4 different passageways of air. Above, you have one. Above the superior conchae, you have an entranceway. Below the superior conchae and the middle conchae, so right underneath here, you have another entranceway. So you have air cells, little meatus there, you have a meatus here. Below the middle and inferior, so you have another air cells or accessway points in there. And then below the inferior, underneath, you have there. So there's 3 conchae, and then there's 4 regions in which meatuses can transmit communication. So in certain situations, when the conchae, the turbinates, are congenitally enlarged, or enlarged because of infection, chronic infection, sinusitis, you can actually do a turbinectomy, in which you actually reduce the size of these turbinates and actually allow for better airflow. So with the nasal cavity, it provides passageway for the airflow and into the pharynx and eventually into the respiratory tract. The first one being the superior meatus. This is a site of entrance for the sphenopalatine foramen posteriorly. It's a site of entrance into the sphenoidal sinus through the sphenoethmoidal recess, and it's above that superior turbinate. You also have the middle meatus, and this is a curved structure. It has the hiatus semilunaris, as you can see over here to the right. If you were to lift it up right about here, that is where you would have the middle meatus, and it's a site of entrance to the anterior ethmoidal cells called the infundibulum as well, along this depressed structure here. Again, that's the hiatus semilunaris. You have an enlarged structure called the bulla, which is the bulla ethmoidalis. It lies above the hiatus semilunaris and is the site of entrance for the middle ethmoidal cells. Beneath that bulla ethmoidalis, you have the site of the entrance into the maxillary sinus. So that's pretty important to note, is the middle meatus has entranceway into the anterior ethmoidal cells. It has entranceway into the middle ethmoidal cells. It also has entryway into the maxillary sinus. And the inferior meatus has entranceway only into the nasolacrimal canal. So now we're going to talk about the blood supply to the nose. So the blood supply, just like everything to the face and scalp, is highly vascularized. There's many different structures that provide blood to the nose, both from the external, from the outside, as well as internally. So in terms of the external blood supply, it comes from the facial artery derivatives, such as things like the lateral nasal artery, the superior labial artery, that provide blood pretty much right around here. Then you have the maxillary artery regions, which come deeper. This comes from things like the sphenopalatine artery, provides blood to the septum, the mucosa inside. The greater palatine, which comes off from the incisive foramen up that way via the anastomosis. You also get branches via the infraorbital artery as they're coming this direction externally. You also get ophthalmic artery divisions, such as anterior and posterior ethmoidal, as they're penetrating this direction into the top portion of the nose. And you also get blood coming from the dorsal nasal artery that provides blood on the dorsum part of the nose. So the blood to the internal nose is effectively divided based on the anterior and posterior regions. So in terms of the internal network of the nose. So the posterior region is dominated by the larger sphenopalatine artery, and the anterior region is dominated by that smaller arterial anastomosis called the Kisselbeck's plexus. So the Kisselbeck's plexus is just anastomotic vascularization that happens, and it's that deeper sphenopalatine artery that's the much larger caliber vessels that actually can have very significant bleed when they do get ruptured or injured for any reason. So again, when we talk about this blood supply, we always have to talk about the cavernous sinus and its relationship to the way in which blood is drained. So the venous drainage of the nose runs in accordance to the arterial system. It runs in parallel just like almost everything else does in the body. And again, just like the eyes, just like the midface, things can either drain through the pterygoid plexus superficially, or it can drain retrograde posteriorly to the cavernous sinus. And again, whenever you have some sort of infection, something's going wrong, something can happen where it can cause a thrombosis or infection in the cavernous sinus, you can cause injury to any of these nerves that are inside the cavernous sinus, cranial nerve 3, 4, trigeminal, and abducens. So now we're going to talk about the innervation to the nose. So the nervous innervation to the nose is broken up into the external and internal innervation, just like the vascularity is broken up into the external versus internal, just like the structural components of the nose are broken up into the external and internal. So the external innervation to the nose is provided by cranial nerve 5, the ophthalmic and maxillary nerves. The ophthalmic nerves compose of things like the nasociliary, which provides innervation to the majority of the dorsum and the lateral portions of the nose, as well as the anterior ethmoidal nerve, which also provides innervation to the anterior external tip of the nose as it runs down the dorsum, pretty much in this kind of manner. You can also get innervation to the nose via the infratrochlear nerve. Provides innervation to the nasolabial folds, right around kind of on the outside, right underneath the eye, the nasal dorsum, and possibly a small portion of the lateral nose. You can also get external nasal innervation via the maxillary nerve, via the infraorbital nerve as it comes out and branches out laterally to the nose. Then you can get innervation internally, and the internal innervation, again, of course, you have the ophthalmic, of course, giving branches to the septum in that direction. Of course, you have the olfactory, giving the sensory fibers as well. The ophthalmic is off the nasociliary. You can also have the anterior and posterior ethmoidal. And you also have the maxillary nerve as well, giving off the superior anterior dental nerve. And of course, this is like a very low yield nerve to remember, but it's just important because that is the sneeze reflex. That is the afferent arm of the sneeze reflex. And then, of course, you have that sphenopalatine nerve, which provides mucosal sensation to the rear and central areas of the nasal cavity, that then forms that communication with the oral cavity via the incisive foramen. So now we'll talk again about some nasal features to the nose. So, in terms of nasal features, the nasal muscles are important. So the movement of the nose is considered a very remnant of primitive evolutionary adaptations. We don't really necessarily have to move our nose as significantly as, say, other mammals had to do in terms of like smelling functions for finding food or things like that, localization of other associated animals. We don't have to do that. Our nose function pretty much is confined to facial expression as well as possibly dilation if we want to get more air in, if we're trying to breathe heavier. But again, we still have a lot of these remnant nasal muscles, so we can do elevation via the levator labii superioris iliqui nasi, via the procerus. You can do depression via the depressor septi nasi or the alar nasalis. You can do dilatation via the dilator nasi. You can do compression via the transverse nasalis as well. And when we talk about the other nasal features, the skin is so important to talk about. So the nasal skin is actually divided up into 3 regions based on the anatomical location and thickness. So the upper 1/3 of the skin on the nose, either around the base, the glabella area, is very thick. It's very thick and mobile. You can actually pinch your bridge of your nose and you can actually lift the skin up. Middle 1/3 is located over the bridge of the nose as well. It's a little thinner, but you can kind of pick it up as well. But once you get to the lower 1/3 of the nose, you can't pick it up anymore. It's almost adherent to all the overlying structures. And it has a lot of significant cutaneous glands that help with a lot of sebaceous secretions and a lot of oily secretions. So all in all, the nasal skin is actually highly vascularized, just like the nose itself, just like the whole face. And it heals well, especially in things regarding nasal defects, injuries, cancer resections. You can do like local flaps, rotational flaps, or even reconstructive surgery with big flaps to actually help restore the normal contours of the nose. And because it's so highly vascularized, it actually heals pretty well. But all in all, you need to do those kind of flaps because the skin, especially in that distal part of the nose, is so difficult to move that you need flaps in order to cover any sort of defect that does happen. So now we're going to go ahead and talk about some clinical pearls. So when we talk about the arterial blood supply to the internal nose, it's hard to not mention epistaxis or nosebleeds. And these can occur for many different reasons, whether it's trauma, nose picking, you're anemic, you have some sort of like leukemia, underlying hematologic disorder, or even some other malignancy. So nosebleeds are very common, but they're either classified as an anterior or a posterior nosebleed. So classically, the anterior bleeds slower and the posterior bleeds faster. The anterior will not bleed as long, posterior will bleed longer. Anterior are not life-threatening, posteriors can be life-threatening. So the anterior ones, it's the one that's provided by some sort of injury to the Kisselbeck's plexus. You usually fix it by some sort of electrocautery, just cauterize it. It's the posterior bleeds that are the ones that have more bigger caliber vessels, like the sphenopalatine vessels, and usually those require some sort of like surgical ligation because you have like a severed actual artery. We're going to mention nasal fractures. So nasal fractures are very common, especially with the nose being such an anteriorly located and projecting portion of the face. It's actually a high risk for injury and fractures. So a fracture of the nose can cause anything from deviation of the septum. It actually can cause fracture and projection of the turbinates and complete obstruction of the nasal cavity. And overall, it just can cause distortion and significant aesthetic concerns that are concerning for people. And even severe nasal fractures to the ethmoid or vomer can cause potentially brain damage if the basal skull was weakened. So if you remember the septum being in more or less in this middle direction right here, this is a septum, vomer, and ethmoid. If you were to break the nose in an upward, superior, and posterior direction, you can actually fracture and break off a piece of the ethmoid or vomer up into the brain and can cause some sort of probably damage or significant, maybe death-related concerns that way. And especially with the nasal ethmoidal area fractures right around the bridge of the nose, those can be very significant because if you disrupt that nasal orbital ethmoidal area, the no fractures, you can disrupt the nasal lacrimal duct, you can disrupt the medial canthal tendon of the eye, and then the eye will no longer function as it should. And then you can also have the nose is important for nasal reconstruction. We talked about a little bit more nasal fractures, aesthetic concerns, especially even things like cancer resections. Nasal reconstruction is such a complex and delicate part of reconstructive surgery. So when you try to reconstruct the nose, you have to keep in mind that there are certain actually aesthetic subunits of the nose, and trying to reconstruct those subunits are important to create that natural aesthetic appearance. And again, because of that really dense vascularization, you can actually get a pretty good aesthetic result when you do any kind of reconstruction to the nose. And you may not need to know, but just for, I guess, your own personal interest, you can actually divide the nose into actually specific aesthetic subunits. You can get the dorsal subunit, the dorsum of the nose. You have your left and right dorsal side walls. You have your nasal tip. You have your left and right alar wall, your left and right soft triangles, and your columella. Those are considered to be all the very unique, distinct portions of the aesthetic subunits of the nasal nose. And that concludes this chapter on the nose. It's a pretty quick, easy chapter. Again, the biggest thing is when you're going through the nose, split it up into the external, split up into the internal, and then that's an easy way to process what each component of the nose is comprised of. Thank you.